Hey, thank you for being part of this webinar, and I hope you're all watching us safe and sound from home. Hopefully, this pandemic will be soon over and we'll be back to normal life. In the meantime, let's try to stay protected and take care of our beloved ones. All right, let's get it started. Today's subject for this webinar is regenerative medicine for intestinal and immunological health and the therapeutic potential of the mesenchymal stem cells. Okay, first of all, who we are. We are an American company based in Cancun, Mexico, where we provide our therapies with stem cells, and our mission at World Stem Cells Clinic and Rehealth is to share and apply our experience with the use of stem cells and cell-derived products as adjuvants in the treatment of different diseases. We also own our blood bank and stem cell bank and a cord blood tissue bank, and we offer several regenerative medicine therapies for conditions such as the one that we're discussing today, irritable bowel disease, that covers Crohn's and ulcerative colitis, multiple sclerosis, lupus, juvenile or rheumatoid arthritis, COPD, Parkinson's. We have also treated some patients with type 1 diabetes. We do a lot of ortho patients here and ortho injuries as well, strokes, and few more. If by the end of today's presentation you're interested in knowing more about the potential effects of this therapy in any of these conditions or in any other autoimmune conditions, feel free to send us an email. You will find our contact information in our last slide. Now, the objective of today's webinar lecture is first, you will get to hear about us. We are based in Mexico again. We are here in Cancun. We own our own bank and have our own lab. We're fully certified to offer these therapies, and also for you to remember what conditions are covered in irritable bowel disease, such as Crohn's and ulcerative colitis, the definition and potential effects of the mesenchymal stem cells in these two diseases. And I will also be sharing some articles and case reports and study reports about clinical investigation and the therapeutic potential of the stem cells in patients with irritable bowel disease. About our processes and affiliations. We are a company certified for the Mexican FDA, which is COFEPRIS. We cover all of the certifications that apply for us by FDA. We are a company certified as a good manufacturer practice by FDA, and also by good tissue practice as well. Our laboratory is built under clean room standard by international ISO 7, International Standardized Organization 7, and now we are affiliated with ReStem, which is a company offering stem cell therapy for patients going through COVID infection with mild and moderate symptoms in the US, mainly in Miami and in South Dakota. All right, let's start with what is Crohn's disease. For those who are not part of the medical field or are not related to this condition, Crohn's disease is an idiopathic inflammatory condition that causes periods of remission and relapse in patients. And these patients will be suffering more commonly from stomach pain, diarrhea, but with the onset of years, we can also get to see a bunch of other symptoms that will affect our patients, such as fever, weight loss, nausea and vomiting, nutrient deficiency mainly by malabsorption, and all of these symptoms, it can get to the point of even causing mental problems to our patients, such as developing anxiety and depression. Okay, so far, is there a cure for Crohn's? Unfortunately, and so far, there's no cure for this condition. Nevertheless, its broader ulcerative colitis in some cases can be treated or close to be cured by doing a removal of the affected area of the GI tract. With Crohn's is way more complicated because it can affect the whole GI tract compared to ulcerative colitis, which is mainly seen in the large bowel, in the large intestine. Um, Crohn's can be managed, the symptoms of Crohn's can be managed with immunosuppressive meds, antibiotics, antidiarrheals, or and corticosteroids. And now we are considering, or we are treating patients because of the good response that we have seen in all of the reports and case reports and studies that are right out there in the internet that you can take a look to, or actually I can share them with you at the end of today's presentation if you want to read all those articles. Now we're treating with stem cells also this inflammatory condition of the bowel with very good response, but it's also important to understand that stem cell therapy is a adjuvant therapy, is something that you must be doing along with the rest of the treatments that your specialist is offering. As we will see later on, whenever we use stem cells in combination with medications, we get to see a higher rate of remission in symptoms of the patients who have Crohn's disease. Now, what is causing this inflammation? What is causing Crohn's disease so far still remains unknown as well, but is pretty well known that there's environmental factors and genetic factors involved. Nevertheless, these factors, these genetic factors are not transmitted in the classical way, meaning the Mendelian inheritance way. And this condition causes the inflammation by activating T cells, leading to tissue injury in the gastrointestinal tract. And this happens because the antigen causes an activation, an unrestrained activation response of the gut, mainly activating the T cells, the T helper 1 cells, which are predominant in Crohn's disease because of the defective regulation of the body. That's why it's an immune condition. And these T helper cells 1 also release cytokines. I'm sorry. Also release cytokines such as interleukin 12, tumor necrosis factor alpha, and stimulate the inflammatory response. By stimulating this uncontrolled inflammatory response, the same body will continue releasing other pro-inflammatory substances such as arachidonic acid metabolites, proteases, platelet activating factor, and free radicals, which result in direct injury to the intestine, as Dr. Gassi et al. State in their article. Now, from this slide, you can also see at the top of it some examples of how of the symptoms or complications that we can commonly get to see in the patients with Crohn's, which in between 70 to 75% of them might develop any of these complications like abscess, formation of fissures or fistulas in between organs like the colon and the vagina, for example, which is a common complication of Crohn's. Also, we get to see strictures, and the picture that you can see in the middle, in between the other two images, in the middle of the slide, is the typical image of cobblestone that you will find when performing a endoscopy or colonoscopy. The patient, if you see this image, it means totally means that the patient is going through a process of inflammation and during a flare of Crohn's, and the patient is positive, although positive for Crohn, although we have to take a biopsy, of course. Also, the continuous inflammation of the bowel causes a chronic inflammation that leads to thickening of the walls of the bowel. So, how stem cell therapy helps with Crohn? Remember that Crohn's is chronic inflammation. Chronic inflammation affecting the GI, mainly the last third of the small intestine and whole large intestine. Nevertheless, again, it can affect the whole GI tract. But the point here of stem cells is helping reducing that inflammation with the use of medications or change in lifestyle, implementing a diet, or any other natural methods. But here, the point here is using it as a adjuvant with very good results, because as researchers have shown over years, mesenchymal stem cells are one of the strongest anti-inflammatory tools available today. And this is because mesenchymal stem cells have the inherent ability to target inflammation. They will find the places where inflammation is happening. They will attach right there and will start these processes of differentiation in order to turn into a different tissue, into a new tissue. And okay. It's also important to keep in mind that the cause, or what is causing this chronic inflammation, is the unrestrained activation of the T cells. As we mentioned before, the T1 helper cells are one of the major involved. Now, what are the mesenchymal stem cells? 1 second, please. Okay. All right. The mesenchymal cells are adult stem cells isolated from different sources. They can either come from bone marrow, from adipose tissue, from cord blood tissue, which is what we consider is the best source for treating these type of patients. This is because the stem cells derivated from cord tissue, more specifically from Wharton's jelly, I will explain what's the Wharton's jelly in our next slide, are the youngest and most primitive cells, the most primitive mesenchymal cells in the body, with a highly potential of differentiation. And another keyword here is that these cells obtained from cord blood tissue, as they are in the youngest and primitive stage, they also share the ability to differentiate faster and to multiply faster than other sources of stem cells. Um, okay. All right, this is then another image where we represent the places where we can harvest stem cells from adult tissues. It can come from bone marrow, the seeded teeth, adipose tissue, hair follicles, etc. From fetal tissues, it can come from bone marrow as well, from liver, from lung, amniotic fluid, placenta, and umbilical cord. Of course, for being called a stromal cell or mesenchymal stem cell, it has to share some positive markers such as CD90, CD73, 100, CD105, 44, and 29, and it has to test negative for some other markers as well. The young nature of these cells allows the enormous potential of transform into whatever type of cells is necessary within the body. Youthful cells also tend to replicate at faster rate, which is what I was just stating in the previous slide. And mesenchymal stem cells have the ability not only to differentiate into other types, but multiply to increase the efficiency, the repairing or healing efficiency in the body. Okay, this is an image just to explain you where do we obtain the cells from cord tissue. And as I mentioned, it comes from Wharton's jelly. I hope you can see my mouse directing here. Is the layer that is covering the vein of the umbilical cord. That's the place where we do a process of scratching, and that's how we obtain the stem cells for treating our patients with irritable bowel disease. Now, the safety of using mesenchymal stem cells um, is perfect, but because they are immunoprivileged. What does this mean? This means that they, by its own, do not cause any type of rejection from the patient receiving the cells. They do not develop any type of allergic response to them. They are completely hypoallergenic. Nevertheless, because of being cells growth in the lab, they are exposed to proteins and media in order to make them grow. And some patients might be allergic to some of these antibiotics containing the media or even the media. And that's why, just as a precaution, we always try to, well, we always provide a pre-medication in all of our patients with antihistaminics in order to reduce to the minimum the possibilities of developing any type of allergic reaction or response to the media of the cells. Nevertheless, our cells went through a very meticulous process of wiping them from all of this media. But again, as our protocol and to provide the highest standard of quality and safety to our patients, we always provide a pre-medication. Now, the mesenchymal stem cells show the ability to avoid negative response from person's immune system without fear of rejection, and of course increases the body's natural healing abilities and have potent anti-inflammatory and immunosuppressive response. Okay, a couple of slides before I mentioned some of the markers of expression that most test positive and some others that most test negative in order to be called a multipotent stem cell or stromal stem cell. And also in the lab, we know how to extract the cells because these cells attach specifically to the plastic uh, contained in the layer of the bottles, the special bottles where the cells are growth and kept with the media. The cells will attach to the plastic, and we will now start the process in the lab of separating these cells. These cells are also called multipotent because they have the capability of differentiate in several tissues. It has been highly proved by several articles from the past 25 years that they can for sure turn into adipose tissue, osteoblast, which is cells from bone, and they can turn into bone, and chondrocytes from cartilage. All right, with mesenchymal cells, what we are aiming mainly is to reduce inflammation, but we are also reaching regeneration of tissues and the best immunological response we can have in our body to certain diseases or harmful conditions to our body. Our body basically will react with the best way it can, and as I mentioned, will create an osmotic environment in where it will provide all of what is necessary to modulate the exaggerated inflammation that the body is going through, and will speed up the process of healing. This again is not a magic process. The patient must be aware that this is a coadjuvant therapy and that he must be treating his condition with, again, either his medications or the recommendation from the specialist, his practitioner. Mainly the activity of the stem cells will be modulating the T cells, the dendritic cells, the macrophage, the M2 macrophage, and the B cells, as well as reducing plasma cell response, T cells, other natural killers, neutrophils, macrophage, and now I will be sharing some information about some articles stating the benefits of providing stem cell therapy in patients with IBD, irritable bowel disease. For example, this article published by Dr. Barnhorn and Associates, mesenchymal stem cells effectively treat Crohn's disease perineal fistulas. Perineal fistulas, as prior mentioned, okay. In this image, you can see the fistula, which can turn in a communication, a fissure that can turn into a fistula, and a communication in between two organs, like the bowels, in between large and small intestine, and in between the large intestine with vagina, for example, or with the uterus. Okay. Dr. Barnhorn also stated that in his patients, the patients after receiving the stem cell therapy showed a lower clinical disease activity and improved quality of life at 4 years. In his results, he reported that 75%, meaning 3 of every 4 patients, had complete clinical fistula closure after 4 years. And he performed an MRI in all of his patients as an evaluation, and after these 4 years, all of them, I'm sorry, 67% of them, 6 of every 9, show an improvement in the fistula tract, of course, of the patients who were treated with mesenchymal stem cells. And he also shown that the efficiency of bone marrow, of local bone marrow therapy for perineal Crohn's disease fistulas was maintained for the following 4 years. Now, here's a picture from the MRI of Dr. Barnhorn, obtained from his article. At the top of the image in the left side, you can see the latest MRI, where you can see the closure and the shrinkage of the perineal fistula. And in the left side, of course, after the 4 years, and the baseline, where you can still see the communication. Now down below in the image, again in the left side, you can have at the left side the 4-year follow-up MRI showing no active fistulas in the bowel, and in the right side of the image, the lower right side, you can see that same patient 4 years ago with at least 3 communications of this fistula. In all of the patients in which he performed the therapy, the resection of the fistula by surgery along with the stem cell therapy, he saw response in pretty much the majority of them, 3/4, 75% of them show improvement, and after 4 years, 67%. Okay, this is another article shared by Dr. Demian Garcia and collaborate, in which he stated that autologous stem cell transplantation for treatment of rectovaginal fistula in perianal Crohn's disease, a new cell therapy, as a new cell therapy. So rectovaginal fistulas in patients with Crohn's disease are very, very difficult to resolve. Rectovaginal fistulas by its own are already pretty difficult to resolve, even with surgical procedures. And these patients went through at least a first attempt of correcting the fistula with no good response, with failure to the surgery, recidivant appearance of the communication. Recent studies have shown that adult stem cells extracted from certain tissues can develop into different tissues, such as muscle, state Dr. Demian Garcia, which is one of the reasons why this therapy is and has high potential to treat inflammatory bowel conditions. And we need to emphasize that these patients failed during the previous performed surgical therapy, and now after the application of the mesenchymal stem cells 2 weeks after the first surgery, the patients showed no relapse in the rectovaginal fistula formation, and after 3 months, later, the rectovaginal fistula was still remain closed in all of these patients. So he concluded that stem cell transplantation to overcome healing problems is a new surgical tool, and careful evaluation of this new modality may provide an opportunity to define a new area in the treatment of surgical changes associated with healing disorders. And well, ethically, for those who wonder, for those worried about the ethic involved in this, we We are obtaining all of our cells from the bank, from cord blood tissue. We do not use any fetus or amniotic fluid or abortion products to obtain the cells. We obtain it from cord blood tissue, and we made them grow here in our lab. Now, an article shared by Dr. Shimizu, mesenchymal stem cells may be able to treat inflammatory bowel disease. Now, as stated in the prior articles, mesenchymal stem cells may have the ability to treat inflammatory bowel disease, according to this study by Dr. Shimizu, and the mesenchymals have been reported to have immunosuppressive effect by polarizing the anti-inflammatory M2 macrophage, as shown in the image where I explain you the lineage of cells, positive and negative, affected by the use of stem cells, and reducing both dendritic cells and neutrophils through prostaglandin E2 and interleukin-10 at the one side. Now, mesenchymal cells can also reduce the activity of T lymphocytes and B lymphocytes involved in this uncontrolled response of inflammation. Okay. And this article by Dr. Casinoti, autologous hematopoietic stem cell transplantation with CD34 positive markers in refractory Crohn's disease. Refractory means that these patients do not respond to the first line of therapy, in medication and surgery, and remission was achieved in all of these patients. In all of these patients treated by Dr. Casinoti, he noted remission, and after a median follow-up of 16 months and a half, 3/4 of those patients maintain both clinical and endoscopic remission, despite the withdrawal of the drugs. Because some of these patients, if you get to read the whole article, you will notice that some of these patients, they were taking off their medications because they were through a process of remission where they didn't even show any symptoms at all. A complete fistula closure was observed in all affected patients. No deaths or life-threatening affection occurred. It's not infection, I'm sorry. Oh, threatening infection, yeah, occurred. Okay, in this image was obtained also from Dr. Chang's published article in 2018, where you can see the left side in both images, at top and at the bottom, the baseline endoscopy performed in these two patients, both of them with the typical image of Crohn's disease. After being treated with stem cells, you can see from the comparative image on the right side how they reach clinical and endoscopic remission of the disease, Crohn's disease. Remember, this is not a cure, even though it's shown here that the bowel is not affected and the patient has reached a point of remission. Crohn's disease, remember, can suddenly appear with new symptoms again. This is a condition that goes through relapse and remission, relapse and remission during the rest of the lifetime. But stem cell therapy can improve this quality of life, as you can see by the images and the studies stating so. In conclusion, stem cell therapy for Crohn's disease in long term is a safe therapy, and mesenchymal stem cells also have a strong immunomodulatory effect, meaning they can prevent the immune system for mistakenly responding to incorrect threats. This is because as any immune condition, as any immune disease, is the body overreacting to some factors that the body shouldn't react that way. The body identifies these antigens or factors as a threat, and starts a cascade of inflammation uncontrolled by the bad response of the immune system. For you to keep in mind and to remember the three major points of the use of stem cells in this therapy is helping reducing inflammation, modulating the immune response of the system, and stimulate the tissue regeneration. Okay. Now, there are also some other derivatives from cell derivatives from the stem cells or the stromal cells known as extravesicles or exosomes. Now, this article says that macrophage, the main cellular target of mesenchymal derivated exosomes in alleviation of colon inflammation. So these extracellular vesicles are released by stress produced in the lab to some mesenchymal stem cells, and these extracellular vesicles will help us boosting the communication in between the cells, causing a better immune response to the inflammation. It will basically do a similar response as the stem cells will do. Macrophages have been identified as the most important cells for the induction of colon inflammation, and several recently published studies indicate that mesenchymal stem cell based alleviation of colitis was mainly relied on mesenchymal extracellular vesicles induced suppression of colon macrophage. So the extracellular vesicles, the exosomes, stop this over-release of macrophages, modulating again the immune response. The exosomes again are these tiny extracellular vesicles of size smaller than 40 to 100 nanomicrons, and again those contain RNA information, mitochondrial RNA as well, and will help modulating the immune response and communication inside of the cell. And once it gets out of the cell as an extra cellular vesicle, as a typical exosome, it will help sharing this information obtained from the cell with the cells that are around or continuous, and will transmit the information in order to help a better response of the immune body in the place required. Why I mentioned the exosomes, I don't want to go deep into them because this webinar is not about exosomes, but I mentioned them because it's an extracellular vesicle obtained from mesenchymal stem cells. We have also the capability of using them and provide therapy here in the clinic, and although with conditions such as irritable bowel disease is way more studied and proved the good outcomes with the use of stem cells compared to the exosomes, which is something that is a new area that is being studied for the past few years. Now, what's ulcerative colitis? This is the other chronic ulcerative condition affecting the bowel. Basically, it affects the same way Crohn's disease does, causing an uncontrolled inflammation, but this can also, this mainly will affect the, the bowel, the large intestine. It will affect the same average of adults, the same age adults in between the 30s and 40s. And this is more dominant in people from Europe. And mesenchymal stem cells in ulcerative colitis has been proved that they can reduce recurrence of disease and hospitalization frequency up to 72.7%, which is an amazing rate. I mean, not even with medications, some patients reach a point of remission, and offering an opportunity of reducing the recurrence of this disease in almost 73% is incredible. I can actually talk about my experience because I suffer from a condition pretty similar to Crohn's disease. I treated myself here in the clinic with the use of 80,000 million, no, I'm sorry, 80 million of mesenchymal stem cells, and I reached remission of my condition without taking any medications for 8 months now. And mesenchymal stem cells treatment allowed most of these patients to discontinue or reduce the use of steroids. Steroids along with other medications, because I was not in steroids, for example, and I had very good response to the therapy. Now, keep in mind that not everything that shine is gold. There are a bunch of companies offering stem cells out there. Please do your research, know the company that you're willing to visit, and check out if they are doing things right. Remember that this therapy is still not approved by FDA in the USA. So any company offering stem cells, which is not for study purposes, are not actually offering a high quality of this therapy. And just make your research, okay? At the end is something that you will be introducing to your body, and you want to know specifically what's going into you, right? Again, we are here to help. We are Rehealth, and we want you to reach control over your life. We are here to help, and we know that there's a better way to live, and we can be part of it. We do not just provide stem cell therapies, we provide life-changing experiences. I'm the attending physician. In case you have any doubts or you want to discuss anything regarding the use of stem cells in any conditions, not just in irritable bowel disease, but in autism, cerebral palsy, or any other autoimmune immune conditions, or if you are considering for anything else, we can discuss if it's possible or not to treat you. Or simply, if you want to know more information, you want us to share the articles that we discussed today and a bunch more, feel free to email me and I'll be happy to share that information. Also, if you want your certificate for attendance, click on the link down below and we'll be happy to assist you to provide it. You can also give us a call directly to the clinic, and if I'm available, I'll be happy to take your call. Also, or Master Mrs. Susana Hernandez, which is our researcher chief associate here in the clinic, can help you with any of the technical questions inside of the lab. All right, well, now let's check if we have questions here. Okay, is there a specific dosage for treating patients with IBD? Yes, well, there's a bunch of studies stating different amount of cells that we should provide to our patients in order to see a response. Nevertheless, we do not like to treat all of our patients the same, because there's no one who is exactly the same to another person. We are all autonomous and require of different therapies, treatments at different times. So our dosages are completely tailor-made for each of our patients. Although I could say that in average, our patients could end up receiving around 200 million mesenchymal stem cells, some cases even more, depending the via of administration and the condition. Talking just about IBD, it will be in between 2 or 3 IV reinfusion of mesenchymal stem cells, and in between 100 million mesenchymal cells up to 300 million, depending the patient and the condition. We also split these dosages, but if you're more interested in how you treat your patients, help us just lift them the phone and give us a call, and I will explain you if you are interested to receive this therapy. And let's see if there's anything else. Okay, Michelle, can you help me if if there's any other questions from anyone else, or Susana?
Hi, actually we have a question about what is the difference between allogenic and autologous cell transplant?
Right. Well, autologous cells means that we obtain it from the body of the patient. And allogenic means that the cells come from a donor. Now, as you may have seen from the articles I shared before, some of the articles of these patients were treated with autologous, and some others were treated with allogenic mesenchymal stem cells. And in both of them, in both studies, remission was reached. In our personal experience, we rather use allogenic cells, meaning from a donor, from cord tissue. This, of course, is the cord tissue is completely tested before and after, and from genetics, and well, that technical information that actually you can respond, Mrs. Susana. And but yeah, the difference is that autologous comes from the own body and allogenic from a donor. What was that? Was that the question? I'm sorry.
Yes, actually that was a question. And there's another question about where, when the patients come to Cancun, where do you get the cells from?
Okay, from our bank. As I stated during the first slides, we own our own bank with all the regulations. Whenever you're ready, that you're willing to visit our clinic, we start a process of expansion and growth of your cells to have them ready for whenever you're visiting our clinic. And that's basically it. It's a process that takes about 6 to 8 weeks, and to have your cells ready for you. Okay. Is there anything else?
I would just like to add, emphasize what Eduardo said, that if you have any questions, please, if you do not think of anything right now, you can write us anytime, and we'll be very happy to talk with you, to write to you, and to share any questions or comments that you have for us. We want to be the best for you, and we truly make an effort to be so. So please, please write to us, and we'll be very happy to read or hear from you.
I can assure you all that we reach the highest standards of quality for all of our patients. You will not be disappointed with the treatment or the therapy and the treat that you will get from all of the personnel here in the clinic. And even if you are not interested right now in in receiving the therapy, but you consider it could be of help for anyone else, we are here to help again, and we want to set this therapy to the reach of as many people as possible, to help as many families as we can, many persons as we can.
Yes, and Dr. Eduardo, there's another question about the approximate cost that this treatment may have.
Okay, now that's quite interesting question. Usually not involved with the pricing of the therapy. Nevertheless, I'm aware that we're throwing a special rate for the rest of the year because of this situation that we're going through. We wanted to be helpful, and we reduced our price to $13,000 US for the rest of the year, although the baseline price of the therapy is of 19,000. But for this year, and just for this year, we are offering this rate of 13,000 US final price in order to help as much as possible. Okay, you can just, if you're interested, you can just ensure your spot by placing a small deposit. We can get you in contact with our office manager, who is responsible of payments and payment opportunities, payment plans. If you want to discuss any of this information, we can get you in direct contact with him, and we'll be happy to assist you. Okay, now by just placing this small deposit, you will ensure the $13,000 price for today, for the rest of 2020. Okay. Do we have anything else? Any other questions?
I think we are done. We are.
That's it for now, right? Okay. Well, as Susana mentioned, Master Susana, I will be checking on all of your posts in this video in order to answer all of the questions that you might have later on. Okay. Also, you can take a screenshot or a picture of our information, so you can give us a call and send us an email, and we will be there for you. All right, it's been a pleasure. Thank you for staying tuned, and I look forward to hearing back from you. All right, bye bye. Have a wonderful day. Stay safe.